We're live.
We're live. All right. Thank you. Good morning, everyone. It's 8:03 on a Tuesday, November 23rd. I'm Deanna Diamore, Health Director for the City of Norwalk. We're going to call the Board of Health meeting to order. Present, we have board members Terry Quell, Janet Karpiak, and Norman Weinberger. And we have Health Department staff Megan Fogno, Aniela Fignon, Brian Weeks, and Teresa Argandesi. So our first item on the agenda is approval of the October 26, 2021 meeting minutes. Do I have a motion?
So moved.
Do I have a second?
A second.
Janet seconds. Thank you. Any discussion?
No.
No. All right. All in favor? Say aye.
Aye. Aye.
Opposed, abstentions. All right, we got it. It's approved. Thank you. The next item on the agenda is the director's report. So I have a few quick updates. For personnel updates, we have, we're very close to filling a vacant health inspector position. So we're excited about that, to have somebody on board who can participate in, food inspections, septic work, salon inspections, supporting general environmental health. So we're excited to have that position almost filled. And we're also filling community health worker positions with a grant that we got from the state. It's tied to our immunization action plan program, but it's also specific to COVID-19 response. So Teresa and Megan are going to be working closely with the community health workers, and we're close to filling those vacant positions as well. So we're adding to our team. It's also budget season, as I mentioned, previous meeting. So we're just working on our operating budget requests and our capital budget requests, meeting with, the different divisions, figuring out what the needs are, specific to, any new expenses, but then also looking at our IT infrastructure, working with IT to figure out what our IT needs are. So we're working on those and expect, we're looking for further guidance from the mayor's office and finance for that, but we're working on it right now. We also have been busy with vaccination. We'll talk more about COVID-19 vaccination, but we've been holding flu clinics, so those are ongoing. I just checked the data yesterday. We've administered about 391 flu shots this season. We had a couple of community flu clinics. We've also had people coming on Thursday afternoons for flu, and then also we're partnering with the library on flu clinics in the library this week. So it's an exciting partnership. We've always worked closely with the library, but within the past couple of years, we've expanded that partnership, and they've been a big supporter of health initiatives. So it's been really great. We also got notice from the state health department that we're going to get additional COVID-19 response funding. The total is $495,935.38. So we're working on that budget proposal now. That money has to be expended starting March 2022, and the funding ends July 2023. So we're looking at our capacity, for contact tracing and other activities related to supporting the response to COVID-19. So we're working on that. So those are my general updates in the department right now. Any questions related to that?
Not a question, but a comment. That money, any of that could be used for mental health issues?
So, that's a great question. And that's something we've brought up to the state, because in particular, one of the health directors is asking about the mental health and well-being of staff too, because they're doing this hard work, and the pushback they get from the public sometimes, from people that are frustrated themselves, and so they've asked that, and we're still looking to get additional guidance on that. We're not sure if it will be able to be, but no, so it's more focused on infection disease control and control of the spread of the disease, but that is something that is very much needed, both for the community and for the staff that are doing the work. So I will bring that up, and I'll say, if I can tell the state that one of our board members asked about it as well, so they know that there's multiple people asking about that. That would be helpful if you're okay with that.
Absolutely.
Okay.
Mhm.
Norman, did you have anything specific related to that, like mental health well-being of the community,
Oh,
recovery?
that certainly is, but specifically, staff is under huge pressure. And, you know, there's lots of talk about the school kids and there isn't a lot of talk about staff. And we're certainly seeing it here. I'm sure Janet sees it in her facility. People are not, and because of all of the pushback and the angry people, and you know, you ask somebody, did you get vaccinated? Man, you got to look out.
Thank you for that. And those are like some similar comments that were made on a call that we had with the state about that need. So thank you. Side note related to that, we're working with our employee assistance provider to do an additional training for staff, you know, where we are in the pandemic now. But so that's still in the beginning phases, and Yella's really helping with some of that research to see, you know, how we want to put that together. But that's just like one component. There's a lot more that's needed. Anything else? All right, thank you. The next item on the agenda are the COVID-19 updates. So Brian, I'm going to pass it on to you to give your updates on where we are with cases, and then Teresa's going to give an update on vaccination.
Great. Good morning, everybody. Here, let me just share my screen. Alrighty. So what should be popping up is the PowerPoint slides. So good morning, Brian here, epidemiologist at the Norwalk Health Department. All right, so what should be popping up right off the bat is the CDC COVID travel recommendations by destination. Along with this is also just kind of like the summarized readout from the Johns Hopkins, Coronavirus Resource Center. So let's start off with that. So global confirmed cases, about 258 million. Global deaths estimated at about 5 million plus. US confirmed almost 48 million, and US deaths about 772,000 plus. And again, these are all likely underestimates because of other kind of variations, especially on an international perspective, in terms of how cases are, kind of surveilled and meet certain classifiers or definitions. So looking at destinations, I think this is really important because now we're in the midst of the holidays. There's a lot of travel going on, what we need to anticipate. And so this is how the CDC has been qualifying relative to COVID activity. Red, obviously, being the highest, or level 4, and then followed by orange, and then a mild orange, and then yellow. And you can see where there's a lot of red. So the United States is currently red, but then obviously surrounding countries in North America are at least at level 3. As well as a large portion of South America. And then you look over at kind of Europe and, Asia, and you can see how Russia is, definitely very much in the red. A good portion of Europe is in the red, which is also a very common destination for people's travel. And also even Africa, and then also Australia at level 3. So not a great situation in terms of COVID and risk of exposures for travelers to those countries, as well as from those countries coming to the United States to visit family members or friends. So, this is kind of just demonstrating the uphill battle that we will be encountering and have been encountering with this recent uptick of activity during this time in the fall, and then consequently moving into the winter. This is the CDC, COVID-19 county levels of transmission for the last 7 days. As you can see from a national perspective, still majority of the counties in the red are high, and that's about almost 73%. But you can see at least, the more common destination like Florida, the southeastern portion of the country is in the yellow, or moderate activity, where we were prior. But as you can see, with the most recent update that came out yesterday from the CDC, all the counties in the state of Connecticut are in the red, including Fairfield County. And so we just entered back into this. We were just in substantial in the previous week. So we've moved into a 7-day case rate of about 112.26. So it is indicating again that uptick, and if not surge, of activity. So that's further supported by the prior week's data points in terms of the substantial activity we're experiencing at that time. In which technically before that, that early part of last week, we were in the late 40s, so that let us sit in the moderate category, but then it jumped up almost to the 80s and then 90s, so very quickly. Um, Again, this is still being, the result of Delta activity, Delta variant activity. So you can see internet or nationally speaking, all regions of the country are pretty much almost at 100% in terms of Delta variant being the cause of transmission. And then from the state surveillance on the right hand side here with the red, again, Delta is really kind of running the show. It's just obviously been given a lot more opportunities to transmit in the population. So why is that? It's a few things. Obviously, this colder weather, especially the wet weather we had over the last couple of weeks. We're also going to have, wet weather, at least supposedly are forecasted for this Friday. So right after the Thanksgiving holiday. You also have, a lot of social activities happening. Part of this has also been the result of Halloween. And so what was really interesting is just seeing like a week after Halloween, if you look at the surveillance data on a case day-by-day basis, you can see it just jump up. And so that's within that really kind of that original time window of when you expect people to present with COVID if they've been exposed. But also other socialization that has been occurring during that time. And, not everybody celebrates Thanksgiving on Thanksgiving. They might also meet up like a week before and, we also have to contend with the fact maybe a week after, along with the holiday itself. And then, also we have to kind of consider waning immunity. And so that's also going to be further kind of demonstrated with something else, another slide as we move forward. But looking at county hospitalizations for the state of Connecticut, again, this is looking at it up to November 22nd, which was yesterday's update. You can see where we were again, back in April 2021, but then, you follow along. And you can see where we're at with the most recent data point. These are current COVID-19 associated hospitalizations. We're at 268. So it's obviously an increase from especially even 3 weeks ago where we were below the 200 threshold. So it is slowly creeping up. And this is probably going to be a continual trend for at least the remainder of this year. So this is something very much that we're keeping a close eye on, but also just to keep a close eye on in general in terms of that activity, because that's also an indication of severity. So then also looking at case rates, keeping in mind it is a lagging indicator. So the most recent update we have from the state health department is from October 31st to November 13th. But as you can see, we did actually jump up from the prior week to 5.7 cases per 100,000. We anticipate this is obviously going to go up about another 2 points in terms of roughly another 2 points with the most recent update that's going to come out this Thursday from the state health department. And as you can see, the case rates, we have like two sections of the state that really demonstrate very high case rate activity. And so that's obviously the eastern portion of the state, and then also this little portion here, which is kind of like, I don't know, I would qualify the Midwest and maybe the western portion of the state. I mean, not fully the southwestern portion, but like Midwestern. And so that's also just kind of, very concerning in that regard, that there's that large pocket of activity, especially in closer proximity to us. And as you can see, also Darien was already in the red based upon this surveillance report. But, the odds are going to increase that, the surrounding towns and cities are also going to kind of enter that fold as we move forward, given the various factors and kind of almost perfect conditions for COVID to kind of, manifest the way that it's manifesting. And so you have the case rates here. I mean, one thing to applaud based upon, these current indicators that we have from the state health department, we have the lowest case rate of the big 7 Connecticut cities, at that 5.7. So again, applauding our efforts, but naturally COVID's just been given a lot of conditions, statewide, nationwide, internationally right now, given, we're experiencing, almost the winter time. And unfortunately, that's just going to how COVID is going to succeed in terms of those conditions. But, I do want to applaud those efforts for the city itself and all our residents. And, in addition to that, talking about the number of cases, we're at 12,849 total cases, 236 total deaths. So we did have an increase by 1 death. This was an 80 plus year old male. So that's something else to consider as well. But we did have a death, which we haven't had in some time. The last 2 calendar weeks, again, October 24th to November 6th for that surveillance period. You have, or actually this is supposed to be the same time period before, October 31st to November 13th, sorry. But as you can see with the age group dispersion or spread, it's still kind of localized a little bit older. So you got 40 to 49 at the large portion, 18%, then followed by 30 to 39 at essentially 15%, then 20 to 29 at 14%. And then you have tied at 4th place, 3 different age groups, 60 to 69, 10 to 19, and then 0 to 9. So again, not great to see that wide dispersion in terms of age groupings, but again, it seems to be a little bit more centralized in the center. except obviously for 50-59 being unique in this sense, looking at this 2-week calendar period. Again, kind of concerning seeing 60-69 enter the fold at, such a larger proportion than usual. And again, I think that demonstrates, the waning immunity argument. And that's why, state and as well as the CDC, FDA are making that push for boosters essentially for all adults. And so this is further justified even from a local perspective. But nonetheless, boosters are now the name of the game in addition to just getting people fully vaccinated. So, that's something else to consider as well. But again, very large dispersion in terms of age groupings and demonstrating transmission. So now in terms of COVID vaccination numbers, looking at from the perspective of initiated vaccination and fully vaccinated, for the city of Norwalk, for all ages, 77.61% for initiated vaccination or getting at least one dose of the vaccine, and 69.94 for fully vaccinated. Hopefully, with the newest report that comes out from the state this week, we're going to get into that 70th percentile. I'm really looking forward to that. I'm going to have a little mini celebration for that. And so, it's also got a goalpost. You naturally want to get to 100%, but, as we can kind of just do the baby steps and get there, it's really nice to see that because that at least establishes that initial immunity. And especially if that number is increasing, that means these individuals are reaching fully vaccinated status in the here and now, which is really good to carry through the winter time, given, my earlier concerns about it, as I outlined before. But again, you can see kind of what we were talking about before with the case rates, the lower case rates on the eastern portion. And you can kind of see that pocket here too, where we're seeing that, I was trying to qualify that Midwestern portion of the state that also was demonstrating very high case rate activity. Flu surveillance, because again, this is another thing that can be an obstacle in terms of diagnosing individuals. As you can see for the country, flu is kind of all over the place, and especially here over in New Mexico. But, it looks like definitely the southern portion of the country as well as southeastern portion, but also, parts of the Northeast too. You see New Jersey, New York, and Pennsylvania kind of being a hotbed activity. Obviously, that's a good number of our neighbors. Connecticut, not as high as the others, but, from the state surveillance standpoint, we do have 4 flu-associated hospitalizations. So we do have, that as well. And I think there's been about 51 detected flu cases throughout the state, but only again 4 of them only resulting in hospitalizations based upon the surveillance that's occurring. Now, there's always that caveat that some people might defer to COVID diagnoses. Maybe they don't want to test people given the COVID pandemic. So there is that kind of bias in terms of those data numbers, but it's something to keep in mind. COVID obviously is the bigger risk given its higher transmissibility. So, and naturally why it results in the pandemic and the situation we're experiencing as of late. Again, a reminder, I'm just going to keep hitting these home, so bear with me. 2 to 14 days from exposure, somebody can manifest symptoms if they are going to manifest symptoms, right? Again, we have to contend with the fact that there's asymptomatic transmission that does occur with COVID-19. But keeping in mind all these different symptoms, I won't keep rattling off every time. But if somebody is experiencing the symptoms, please get tested. Don't show up to work or some other capacity and run the risk of exposing others and then creating an outbreak or another scenario that needs control. PCR testing is still preferred just because of its greater reliability and sensitivity / specificity. But, and just reminding other healthcare institutions out there and also individuals that seek their healthcare, that rapid testing is really more, antigen testing is really more appropriate for the first 4 to 5 days of somebody that's being symptomatic. So that's just really just an important point to emphasize. Again, for COVID testing, as well as even vaccination, check out the city's web pages. So for testing, that's norwalkct.org/testing. For vaccinations, technically norwalkct.org/vaccine. But again, keep in mind the testing site we do have at Vets Park. And check out our social media for the holiday schedule. That's going to be important as well. And also, if you want to learn more about what's going on, definitely check out the weekly reports. It is on pause for this week, given the holiday, but most recent report is out and still relevant. And so definitely you can check those out on the city's webpage as well as social media. So that is my coverage. Thank you, everybody.
Thanks, Brian. Any questions about any of the data?
Once again, Brian, a great report, very thorough. A question has been raising all over the place about whether people should be tested the day that they travel. Any comment about testing? And most people are talking about antigen testing.
Well, it'd be preferred if somebody's not symptomatic and they're just doing it as a screening measure that, Yes, I think that, there's the ability to do antigen or PCR testing. CDC hasn't been very selective, and, they have clarified on the website, but it's somewhere buried in the fine print. It is preferred, again, if somebody can do PCR testing. The catch is they do it for travel. There might be issues with getting that covered by insurance and things of that nature. So that also might be the other caveat there. But, it would be preferred to do PCR testing just to catch, especially somebody that's asymptomatic before they travel. But again, contending with the fact that they could also test positive if they had a prior infection within the last 90 days of that too. So accounting for those kind of caveats. As with COVID, the number of complexities keep layering more and more.
Exactly. Exactly.
All right, Teresa, can you give an update on boosters and vaccines?
Sure. Good morning, everybody. So on the booster front, some news in that the FDA and CDC are now have now issued a advisory that anyone 18 and older who is at least 6 months out from their primary series of an mRNA vaccine or 2 months out from their J&J shot are eligible for a booster. And so we had been trying to get the message out to the community even before this that, with the previous eligibility criteria or guidance, that the vast majority of people in our community were likely eligible for a booster, either because of their work setting or an underlying medical condition. There were several in that list of underlying medical conditions that were very common in the general population. And so trying to get that message out to folks that if they really wanted a booster, they were more than likely eligible. And so now that the CDC and FDA have clarified and recommended that or made eligible anybody over 18 as long as they're far enough away from their primary series, that really helps with the messaging. So we're working on trying to get that word out. The CDC did add a little bit of a layer of detail to that recommendation in saying that anyone 50 or older or anyone 18 and older living in a congregate setting are recommended to get the booster, and that anyone else 18 and older may get the booster once they make their own risk benefit calculation and decide whether or not they think it's beneficial. We encourage people, if they're interacting with the public, if they're going about daily lives and they're 18 and older and far enough away from their primary series, that they go get a booster. We're also trying to get the word out to folks that anywhere that carries the booster brand that you're looking for should be able to get you a booster. So we put out various schedules and information about where people can go for COVID-19 vaccines, and just making it clear that if the provider is carrying, if you're looking for a Moderna booster and the provider is carrying Moderna, they will be able to give you a booster. If you're looking for Pfizer and that provider says they carry Pfizer for adults 12 and older, they should be able to get you your booster. So of course, you always want to call and confirm or make an appointment at some of the places that are taking appointments just to verify. But there is no special, booster appointment in most of these places, and even the walk-up clinics can offer you a booster, even though they've been, giving primarily first and second doses up until boosters were available. Now they're also giving boosters as well. So really opening it up, getting that message out to folks, encouraging them to get a booster and to seek that out. The weekly schedule that we post on norwalkct.org/vaccines, we've added some detail to the schedule so that you can see which age groups are being served. So there are a few, especially Griffin Health clinics, that are only for pediatric Pfizer. So they're only serving 5 to 11-year-olds. But most of the other clinics out there are doing 12 and up, anybody 12 and up. Some of them, like the clinics at Best Park, are serving 5 and up. So they have the pediatric Pfizer and they have all the brands for the other age groups as well. So just trying to get the word out about that, but then also recognizing or reminding people that there are a lot of other providers that aren't on that weekly schedule. So We're happy that that schedule gets a lot of attention and that people now kind of know where to go to find that rainbow, that rainbow schedule that we put out. But just reminding them that their vaccinefinder.gov or vaccines.gov/search is a great place to go to find any of the many retailers that are offering vaccines. So even, if there is a clinic, on a particular day there's no appointment necessary and walk up, rather than, take a chance that there might be a long line at that place, you can also get an appointment at CVS, at Walgreens, at Walmart, and a lot of other providers that are found on that vaccine.gov search engine. So that's the story on boosters. We've also been trying to pull together a list of all the pediatric clinics in the community, the mobile clinics at least, reminding folks that their pediatrician's office may be offering the vaccine for 5 to 11-year-olds, and that there are several retailers and other healthcare providers who are offering that vaccine. But just kind of pulling together a list of all the mobile clinics that are happening in the community, which among them are available to 5 to 11-year-olds, so that if a parent is already vaccinated, they don't have anybody 12 and up who's seeking out a vaccine, and they're just really zeroing in on that pediatric age group, they can figure out which of the clinics at a quick glance. And there are a lot of them. So we have a lot of great providers and partners in the community that are offering vaccines to that age group. Norwalk Public Schools has recently started partnering with Griffin Health to offer clinics on school premises, and Griffin and Norwalk Community Health Center and CHC Inc. have been offering pediatric clinics as well out in the community in other locations throughout the city. So really just spending a lot of time trying to bring together these partners, coordinate their efforts, make sure that nobody's duplicating, and that if there's any gaps, we're able to fill them as quickly as possible. And then just as a little shout out to the health department, we had 2 Moderna booster clinics, one at the aquarium and one at City Hall that were very successful. And also we held a pediatric clinic at the Maritime Aquarium. We're so grateful for that partnership with the Maritime. It was a great event, and the kids were able to get their vaccine. And then while they were being observed for their 15 minutes, they got to watch the seals kind of swimming around and hanging out with them on a Wednesday evening. So we're excited about that clinic and looking forward to giving them their second doses in December. And I think that's my update.
Thank you, Teresa. Does anybody have any questions about boosters or vaccines? Really want to thank my team for all that they've been doing and our volunteers, especially for the clinics, because they've been going out and doing, booster clinics and pulling together the pediatric clinic. I think they were doing like 4 clinics in 1 week. So really pulling together, it's a lot of work coordinating all of that, in addition to coordinating efforts across the community. So thank you very much to the staff and to the volunteers for all that they're doing. All
We'll
right.
just comment that my grandson, who is 7, got his booster, and they gave him a penguin ice pack and some kind of toy. So he was really excited about it. So they did a really nice job. So good job, everyone. I didn't get any penguin ice pack when I got my booster.
It's so funny, like even at our flu clinics, it's all the adults who are like, where's my lollipop? Like they're always like, where is it? The sticker's great and all, but I want my lollipop. Thanks, Terry. So just as a side, as cases are going up, as COVID continues throughout the community, just remind everyone to get their booster dose if they're eligible, if they're 18 and older, and if it's been longer, than 6 months with the Moderna or Pfizer, or 2 months with J&J, to get their boosters, wear their masks when they're in public settings, when they're not sure, who's vaccinated, who's not vaccinated, and just really assess your risk level and to make the decisions that are, smart for you and your family. But get those boosters. The vaccinations have been doing amazing things. So thank you, everyone. We're going to give just a quick reaccreditation update. We do have our site visit scheduled for December. Megan, I don't know if you want to give a quick update or if you want me to.
You can, no. I'm so excited. We're almost there. The team has been working tremendously to get all the measures, all the responses to the measures done. So we are scheduled for December 15th from 12 to 4. It's a virtual site visit. We will have our final draft agenda no later than December 3rd. So at least we'll know what to prepare for, like what, kind of things they may ask us during our site visit. And so right now we have a 2-person site visit team. They're reviewing all of our documentation again, and then they're preparing for the site visit. I'm just so excited that this will be here before the end of the year, so that, we eventually will be able to be reaccredited and good to go. So we'll keep you posted, and as you can tell, I'm very excited. I know Deanna is too, and so we will keep you in the loop with the time coming. Anything else?
Thanks, Megan. All right, and then the second to last item on the agenda is the meeting schedule for next year. So I wanted to talk about, we don't have to set the schedule today, but I wanted to discuss some things with you all. We have to set it by December, I believe, for the 2022 meetings. I know sometimes it's difficult for some people to make, Tuesday mornings. And I know, so I'm trying to figure out like, what are the days we want to meet? And then I also wanted to talk about if you'd be open to meeting in the meetings instead, in the evenings, instead of like 8 o'clock in the morning, if we could do a 5 or 6 o'clock meeting in the evenings one day. So I just wanted your thoughts on that. We could also send a poll around. I could reach out, not everyone's on today, but what are your thoughts for, and also in person, like we have to decide if we want to do like a hybrid, like in person / virtual, or if we want to just continue virtual, at least for the beginning part of the year.
Well, I'll speak for me. Mornings are best. Tuesday morning is a little difficult. Thursday morning would be the best for me. Meeting in person is wonderful, but then I have to hightail it to go up to Bridgeport to my clinic, and that makes it stressful. This is not very stressful. This is pretty easy.
Thanks, Norman.
Yeah, and
How
I
about-
agree, having either virtual or a hybrid, depending on what the climate is. It is much easier to be able, I guess it's wonderful to be able to sit in person, but not have to fight the commute to get to the office in time for appointments is a big thing. So this is very helpful. And if I happen to be on the highway, getting on the way back from babies, I can actually get in by phone. So, I can at least have more of a presence. I'm fine with virtual or in person. Virtual works for me. It seems like we do get better participation that way because it does make it easier for folks who have to travel. I'm fine moving them to evening. I'd be perfectly happy with that. Whatever works best for your schedule doesn't matter to me. 8's kind of early for me, and it doesn't seem like we get very much public participation. So I've always said, if we move it later in the day, we might get a little bit more participation from the public.
Thanks, Jerry. I was thinking that as well. I know we've gotten feedback from the public about it would be better for them to have it later. So I was thinking about that too.
I think we're the only board or commission that meets early in the morning. Is that correct? I don't know if you know that answer, but at one point we were the only ones meeting early.
I think so. Yeah. I don't know exactly, but I kind of, yeah. I know there are some, I think, that meet in the afternoon, but I think most meet in the evening. All right, well, I'm taking your notes down and then I'll pull everybody else, but I think we definitely agree. Virtual for sure. We could do a hybrid if we want, but everyone likes the virtual option. Okay. All right, thank you, everyone. Anything else before we move to public participation? All right, I see we have one member from the public with her hand raised. So Megan, do you wanna?
Yeah, I unmuted them. They're allowed to talk now if they just want to unmute themselves.
Ms. Larcella, do you have a comment? Would you like to participate in public participation?
Yes, good morning. This was a very interesting meeting. I mainly just wanted to say thank you to the staff and the board, but especially the staff in getting through the second year of this pandemic. And there's been some really innovative ways to vaccinate, and especially that Maritime Aquarium location just sounds like it was not only fun, it was educational, and it really helped include important community partners, and I know that's continuing. I wanted to wish you all a good holiday time of rest till next Monday. I wanted to also say that I agree because I kind of think I at times represent the public over the years in various capacities. And I very much encourage this board and the staff to have meetings at either late afternoon or early evening, because, and virtual is fine. I think it offers a lot of additional educational opportunities. Mr. Weeks, the way that he shares the screen, others of you and the staff have offered links and information. It is more convenient, and we could even be in our sweats in order to learn about our local health status. So and I've spoken to some other folks that just cannot make an 8 o'clock meeting. As you know, I was one of the folks that have asked for at least alternatives. And I appreciate, Deanna, that you have, before you set your schedule for the year, that you have put this on the table. I wholeheartedly think that the time has come. I know it's been a tradition for a while that 8 a.m. is the time. The thing is, though, with the public having to also deal with COVID and juggle schedules, I would love to see some method that this board can be, and its good work can be seen by the public. And I will help get people to the meetings, even if they're virtual. So if you decide not to switch out of the morning, then could this board at least consider maybe on a quarterly basis having an evening quarterly public input session where the public can not only see the good work of the staff and the department, but also offer some ideas and also give some shout outs. I think that at the very least needs to happen in a time where we are utilizing Zoom and other platforms as a way to democratize our society, especially in Norwalk. Lastly, I wanted to say I'm going to be emailing you, Deanna, 2 or 3 ideas for the budget cycle, operating budget and capital budget. As you know, I participate and read the budgets, and I have some ideas that I think could be easily already fundable with the federal money and beyond, that would help on issues other than COVID. I know that's taken up a lot of, and rightly so, the time of the staff. But there are, as you know, there's other issues that never sleep. One of those is PFAS, the forever chemical. I very much feel that I think that you deserve and your staff deserves the opportunity to have an on-call hydraulic engineer to assist in being trust but verify the 2 water companies that we have in Norwalk, especially the First Taxing District, which has, of course, had to tell the health department they have in their well field PFAS contamination, but they have a complicated system where they combine their well field drinking water, the groundwater, with their reservoir water. it's complicated. So I think it would be helpful, just like you have Brian Weeks with the epidemiology. I don't think you need a full-time hydraulic engineer, but I would love to have the city, and I'm sure they would, fund an on-call engineer. They have some great engineering companies already on their purchasing list. And that way they can just help you when the water company discusses how they mix their well water with their reservoir water. And this would just be a check and balance. And I think it needs to happen. As you know, we sat side by side when the State Health Department started out with the PFAS exploration. What was it, 2 years ago? It was in person up in Hartford. Oh, so many years ago, maybe 3 years ago. I don't remember. But anyway, I think that would be helpful. So with that, have a great holiday. Thank you for all your work. And I look forward to the future. And I really hope that we can have some evening meetings for the public. Thank you.
Thank you, Ms. Loretella. Thank you for your suggestions, your comments, and thank you to the staff. Is there anything else before we wrap up? I don't think we have anybody else from the public. All right. Well, happy holidays, everyone. Happy Thanksgiving. Hope you get to spend some time with your family, spend some time relaxing. And I guess we will see you next month. All right, it's 8:45. We're gonna adjourn. Thanks, everyone.
Have
Happy
a safe
Thanksgiving.
holiday,
Happy
everybody.
Thanksgiving. Bye-bye.
Take care, everybody.